The next one we have is respiratory. Respiratory, you want to have between 12 and 20 breaths per minute. So again, you can take this number. No, you can't times it by 2. I have to check this. I put that you could do 30 seconds times 2 and get a number. But you probably can. So listen to this. Sorry, like I said, it's been a little while before, a little while after me taking this test and coming back to you guys. So if not, I will definitely check it out and I'll get back to you. But again, respiratory is anywhere between 12 and 20 a minute. And you do this by simply looking at a person's chest, inhaling and exhaling. And they say we should do this and not tell the patient, because then the patient will hyperventilate trying to just get it over with. So you can do it when you're listening to pulse or, you know, recording for pulse. You can do it at any point, but again, you don't have to tell the patient, because then the patient wants to get everything over with. So do it as normal as possible. The next one on our list is pulse oximetry. And with this is basically the amount of oxygen that is in your blood, that your blood carries. There is a machine for this that goes on the fingertip, which I found was really interesting. I always wanted to know what that machine did. So it's just a little thing you put on your fingertip and it reads these numbers. So normal numbers should be anywhere between 95 and 100. Anything less, sometimes again you might want to recheck it, because that could require that someone needs oxygen if their number is lower than 95. And then last on our list is pain, and this is just a scale of 0 to 10. You know how when you go to the doctor and they say on a pain level of 0 to 10, what's your pain? That's all that is. Now, listening to the heart, you're going to do it in 4 different places, and I call these places apartment M, or there's another thing, all parents teach manners was another way they taught us. All parents teach manners. I like apartment M, it's straight to the point. I don't like those, I feel like it's too much. Anyway, apartment M. So apartment M stands for apical, pulmonic, tricuspid, and mitral, excuse me. So at where you want to hear the apical sound is going to be the second intercostal space, right side sternal border. Know this because they are going to ask you. So again, apical is second intercostal space, right sternal border. And basically, it's pretty much in this area. I'm not one for feeling. They say, you know, go from the angle of Louis, go down and over, and you'll feel it. And I don't ever feel these spaces. Sorry. But again, I mean, if you're kind of in the area, you can hear the heart. The next place that you want to hear is pulmonic, which is directly over from apical, second intercostal space, left sternal border. Second intercostal space, left sternal border. The next one you come down is going to be tricuspid, and that's in the fourth inner space, left sternal border. And the last one is the mitral, or the apex, and this is going to give you the best sound, and that is the fifth intercostal space, left mid-clavicular line. Mid-clavicular, so they're coming from your clavicle going down, or mid-clavicle, excuse me, going down right under here. Fifth intercostal space, left mid-clavicular line. And that is apartment M. When it comes to listening to breathing sounds, I call this BBV. And this stands for where you're going to, again, listen for air sounds and lung sounds. So again, BBV. And the first B is bronchial, which is going to be a loud pitch. The next B is bronchiovesicular, which is a medium pitch. And then the V stands for vesicular, which is a low pitch. And these sounds are going to be heard here, close to your trachea. So that's going to be your first V. This is going to be a loud breathing sound. Your next B is going to be a little lower, and that is the bronchiovesicular. And the last sound is under the rib area in here, and it's going to be a low pitch. So this one's not as loud as the other two, but you can still hear breathing in those areas. BBV. Now, I told you that I was going to talk a little bit about abnormal sounds and abnormals in general. So the first thing that I want to talk about is going to be pulse. Excuse me. Your pulse can either be high or it can be low. I don't know why I have this one. So I'll hold my finger there so you guys can't see that. So when it comes to pulse, you can be tachycardia or bradycardia. And tachy means it's going to be high. So you're going to have a pulse that's higher than 100. Brady means low or below. B for Brady, below. Which is going to be under those 60 beats that I told you about. And I do see why I put this one. Another one is called dysrhythmia. And that's when you have an irregular heartbeat. So again, tachy is high, Brady is below or low, tachy above 100, Brady below 60 for normal pulse. When we talk about pulse, again, you can either have a very high pulse or very low pulse. So we grade the pulses. You can be 0 to 4. 0 is what we call absent, where when you feel it, it's very hard to feel, very hard to feel that rhythm. Then we go to +1, which is thready. You can feel it, but it's again very hard to get. 2 is normal. That's where you can put your finger there and you can feel it. You can get that do-doom, do-doom, do-doom feeling in your fingers. 3 is full, and this is an increase. So you can feel it, but you can feel it a little bit better than 2. And another way that we figure these out is try to completely obliterate these. So when you push it down, can you still feel it? Like, is it still like thumping out? That's what we would call a +4, and this is bounding. It's where like you feel like the pulse is like jumping out at you, boom, boom, boom. So that's the scale, 0 to +4. So I'm going to take a tad bit of a break. I don't want you guys to get bored. So I will be right back with another clip. And we'll talk a little bit about the rest of these that I have on here. And we'll talk a little bit about some math. I'm trying to make it easy for everyone. I know I had a lot of issues with math when I was in high school and college. So I do have a little bit of an easy way. Hopefully it helps you guys as much as it did me. But I will talk to you in just a few.